Good morning. Today is Friday, May 22nd. My name is John Kinseth. I'm the Deputy City Manager here in the City of Decatur. Today I want to start by talking to you about the things that the city has been working towards over the last 2 months during the governor's stay-at-home order. All of our staff has been transitioned to the capability of being able to work from home and continuing to provide services to our residents. Certainly some job functions do not allow for working from home, and those job functions have continued to be carried out here in the office as we are today. During the past 2 months, the city has been providing support and a coordinated response with the Macon County Health Department, the Chamber of Commerce, the EDC, the United Way, and many other social services. We have continued to provide reliable public transit service while making the adaptations necessary under the current COVID-19 crisis. This includes providing additional social distancing measures as well as providing face coverings to our public transit riders. We've also been providing relief measures to our residents and to our businesses through extensions of water bills, extensions of licenses, and other type of relief measures of that kind. We have been working towards streamlining and automating our services online so that we can provide a virtual City Hall 24/7, and we hope that this will continue even beyond the current crisis that we are in. We have continued to promote and encourage the 2020 census participation, and I encourage that if you have not yet responded to the 2020 census, now is the time to do so. Every person counts. We want to make sure that your vote and your opinion matters during the 2020 census. We've been preparing the Civic Center to be safely reopened to the public, and we anticipate doing so sometime during the month of June. What that date is, we do not know at this time, but more will come in coming videos. We have begun discussing budget shortfalls and how to cut costs without impacting services that our residents and businesses rely on. I want to also bring up the fact that this is a long holiday weekend, and I ask that people be responsible this Memorial Day weekend and maybe opt for a family picnic instead of a large cookout gathering. As we look forward, we have 1 week before we get to May 29th. May 29th is when the City of Decatur anticipates moving from Phase 2 to Phase 3 under the governor's 5-phased reopening plan. Phase 3 will bring new changes to the City of Decatur and Macon County. We anticipate bars and restaurants being able to reopen with outdoor dining, and the city is working with those businesses to provide outdoor spaces, whether it's on parking lots, sidewalks, alleys, even potentially closing streets, to allow for those businesses to start to provide outdoor dining experiences for our residents. We know it's been a long time since you've been able to go out and eat in an establishment, and we hope that this will start to bring back some return to normalcy, although I can assure you it will be different than what it was a few months ago. All state parks, golf courses, and other outdoor recreational activities, including camping, will also be reopening as of May 29th. There are many more positive recreational activities that you can start to participate in as we look forward to the coming summer months ahead of us. Health clubs, retail, personal care services will also be allowed to reopen over the next couple of weeks as we move into Phase 3. Again, the city and the Chamber of Commerce and other business leaders are having those discussions about what that looks like, what type of protocols will need to be in place before they can do so, and what type of preventative measures that we can all take to protect both the businesses and the residents that frequent those businesses so that we can all remain safe and continue to control the spread of COVID-19 here in Macon County. The number of cases do continue to rise, but we are still on track. We still have positive health metrics that will allow us to open on May 29th, and we hope that that will hold that way. As we look forward to what's ahead, weeks and months ahead of us, we all need to continue to do our part, maintain social distancing, and wearing a face covering whenever appropriate. I know that the face coverings are something that is a significant change in our lifestyle and our appearance, but it is absolutely necessary if we are going to continue to slow down the spread of the coronavirus here in our community. If we don't maintain responsible behavior, we all risk the fact that we could end up backtracking to what we've just come out of over the last couple of months. That certainly is not the desire, and it will not be good for any of our businesses, residents, or our local economy. We all need to do our part, wear the face covering, and when I say wear the face covering, it doesn't necessarily mean let it hang from your ears down below your chin, because this does nobody any good. Also, just partially covering with your mouth and not covering your nose doesn't do a whole lot of good either. If you're going to wear the face covering as is recommended and required, it needs to be worn appropriately. It also needs to be taken off and disposed of appropriately if it's a disposable mask. It needs to be laundered regularly if it's a reusable mask. All of these types of things need to be done by everybody in order for this to work. One last reminder to look forward to, the city will be hosting its regular citywide cleanup on June 3rd from 2 p.m. until 6 p.m. Please, no electronics, no yard waste, no paints or hazardous waste. Please wear a mask. Try to provide social distancing between yourself and others at that event. But otherwise, we look forward to continuing to get back to some type of normalcy and continuing to have some type of events that the city has come so accustomed to from previous years. Thank you.
Hello, I'm Dr. Mark Scott, and I'm the medical director of the SIU Center for Family Medicine in Decatur. And during the COVID-19 pandemic, there have been some changes that have been made to the practice of medicine and in the way that you can access care. One of the things that has changed is the simple scheduling of appointments. Now when you call to schedule an appointment, you will be given a couple of options on how to see your provider. The first option is to come in for a traditional visit like you always have, but some things will have to happen before you're allowed to come in. There are several questions that you'll be asked on the telephone that relate to symptoms of COVID-19, such as, do you have a cough? Do you have shortness of breath? A sore throat? A fever of 100.4 or more? Loss of sense of smell or taste? A headache? Muscle pains? Nausea, vomiting, diarrhea, or chills? If you answer no to those questions, then it is likely you'll be able to be scheduled for an appointment. But don't be surprised if when you arrive at your appointment that you're asked the exact same questions you were asked on the phone. And if you are able to come into the building, you'll notice that the reception will be wearing personal protective equipment. They'll be wearing face masks and goggles and eye protection of some kind. Your nurses and your providers will be wearing gloves and eye protection that is either goggles or a face shield. And they will also be wearing face masks. And that is to protect you from respiratory droplets. So don't let any of that alarm you. It's all a safety measure that we're doing with all patients that come to their appointments now. Another option that you may have is for what is called telemedicine. So if you answer yes to any of the questions on the telephone, or if you're afraid to come to the office, or you have transportation issues or mobility issues, then you'll be given the opportunity to see your provider through telehealth. And what is telehealth? Telehealth is a means of providing health care where the provider and the patient are in different locations. And that is done by using technology. So either a telephone or the internet. So for a telephone visit, you'll be able to talk to your provider over the telephone And the provider will be able to ask questions about your condition, any symptoms you may be having, review all your active problems, your past medical history, review all your medications and allergies, look for any tests, lab work, x-rays that you may be due for, as well as any preventive medicine that you need. And we'll be able to provide orders for those things that you need, as well as a plan for your chronic problems. Another option, if you have a Android phone or an iPhone or a laptop or computer at home that has a camera, would be to do an internet or web-based visit. During that visit, you'll be able to be provided all of the things I mentioned for the telephone visit, in addition to being able to see your provider and your provider being able to see you. So there are certain things that your provider will be able to actually examine you. For instance, if you have a skin condition that needs looked at, a rash, a skin lesion, a muscular condition, a bone or joint issue, your provider will be able to do a limited exam based on the fact that they can see you. So it's very good for those types of problems, in addition to being able to provide all the things that I mentioned. Another piece of good news is that during this pandemic, the state of Illinois has mandated that Medicaid and private insurance cover telehealth visits 100%. So again, if you're needing to be seen during the pandemic, you can schedule an appointment and have a traditional visit with your provider, or consider having a telephone or web-based visit through telemedicine, particularly if you're having symptoms or if you have mobility issues, transportation issues, or if you fear leaving your home. Thank you for your time, and stay safe.